Mr. Chairman, first let me join my colleagues in recognizing your leadership and your stewardship during this long and intense debate. I know you've worked hard to make this a good bill and how hard you've worked to make this a fair proceeding as possible. Now it's time to vote. It's a historic vote, one of those occasions when each of us must weigh any lingering concerns against our responsibility to act and to act wisely, for the lives and livelihood of the American people literally lie in the balance. I will vote for this bill because it goes a long way in the right direction. I'll vote to move it out of the Finance Committee with the hope that we'll continue to improve it, especially in making health care more affordable and providing choice with a strong public option. The amendments we passed have made this a better bill. It protects consumers by providing insurance market reforms to help rein in costs and expand coverage. It includes amendments I sponsored to help families fighting health insurance bureaucrats who denied them coverage when they needed the most, amendments to provide coverage for behavioral health treatments, including for children with autism, and support services for women suffering from postpartum depression. It protects federally qualified health centers so they can continue to provide much-needed care to families in our communities. And it contains necessary changes to the excise tax, recognizing that retirees and high-risk workers have additional health costs, changes that raise the thresholds more generously to save millions of family policies from being hit. And we look forward to doing more. Overall, Mr. Chairman, this bill is now, in my view, a fairer bill for families. It protects children and families facing hardships or who are unable to afford coverage, children growing up with grandparents, children who may be aging out of foster care, children with parents whose employers do not provide dependent coverage. It includes my amendments to provide consumers with assistance when they feel they have been unfairly denied a claim from their insurance company or charged outrageous rates when they are rushed, often unconscious, to a hospital. These amendments, among others, have strengthened the bill. Now, I would have liked to see the bill go further on affordability. I fundamentally believe that if we place a mandate on families to purchase coverage, we have to ensure that that coverage is truly affordable. Mr. Chairman, I know you made every effort to incorporate my amendment on lowering premium caps, and I want to commend you for that. And I look forward to going further as we bring a final bill to the floor. For families across America, including families in the territories, accessing affordable coverage is, in my view, a critical part of any health care reform package, and we have to make sure we get it right. But the bill we will vote out today does not include a strong public option, one that will provide consumers the real choice they need. I know there are those who say we don't want government involved in health care. Well, I would remind them to look around. The health care system we have in America is a private system without government oversight, and it's not working. This weekend, we not so coincidentally hear that the insurance industry suddenly claims, or more accurately threatens, that under this legislation, premiums could rise faster and higher. How convenient that they came forward at the 11th hour, after all the negotiations and discussions, after all the hard-fought debate, after all the study in and out of the industry. Suddenly insurers have trumped up a deeply flawed report, contradicted by more thorough studies, claiming costs that are increased, yet admitting that they did not consider all the reforms included in the bill before us. The simple truth is this bill requires every American to have health insurance. It could not be clearer. More people will come into the system, but that's apparently not enough for insurance executives. In my view, Mr. Chair, if the insurance industry is making bogus claims in one last effort to sink health care reform by playing yet another fear card to scare average, hardworking families, then it's one more indication that we're on the right track. One more indication this legislation is the right legislation at the right time for all the right reasons. The truth about the insurance industry and the present system is that they are coming between doctors and patients. Insurance executives are making medical decisions based on the bottom line. Costs are increasing, the quality of care is decreasing, options are being limited, reliability fleeting. Truth is, a public option would not be government-run insurance. It would be self-financed and self-sustaining. To me, that is not a government-run insurance program. Most importantly, instead of rewarding risk management, it would reward good work and innovation. It would promote performance incentives, just as Medicare promotes quality care while keeping costs down. So I hope we'll get to see a public option in the final bill that comes before the Senate. Finally, it seems to me that the fact is to vote against the bill before us is to do nothing. It is a vote to stay the course and let market forces continue to treat the health of the American people as an investment minimizing risks, maximizing profitability. A vote against the bill is to be for the status quo, for the insurance companies to continue to permit the constant denial of health care when you need it, rising double-digit premium increases, and for millions to continue to have no health insurance whatsoever. The status quo that some of our colleagues are trying to protect is a health insurance Ponzi scheme, where insurers collect ever-increasing premiums from families, then do everything in their power to minimize their own risk by denying them claims while finding a way to pay benefits only when absolutely necessary. That's fundamentally wrong, Mr. Chairman. That's what we're trying to change. That's what your bill does, and that's what I'll be voting for.
Well, thank you, Senator.